Hey everyone, and welcome. Today we're diving into a really complex and pretty rare condition that's a puzzle for patients and doctors alike. It's called Behçet syndrome. We're going to break down what it is, what it looks like, and how it's managed. So let's jump right in. Okay, so think about this for a second. How can a single disease cause something you might think is pretty minor, like a mouth ulcer, but at the same time cause something as terrifying as blindness or life-threatening blood clots? It sounds wild, right? Well, that question really gets to the core of what Behçet syndrome's all about. The reason it can hit so many different parts of the body is because it's attacking something that's everywhere in our bodies, our blood vessels. All right, so to wrap our heads around this, here's the plan. First, we'll cover the absolute basics. What even is Behçet's? Then we'll get into all the different signs it can show. After that, we'll walk through how it's diagnosed, how doctors manage it, and finally, we'll look at the long-term picture for people living with it. Okay, first things first. What exactly are we dealing with here? Let's get the foundation right. So, at its very core, Behçet's is what's called a chronic autoimmune disorder. Let's break that down. Autoimmune just means your own immune system gets confused and starts attacking your body by mistake. And chronic means it's a long-term thing, not something that just goes away. And what's the target of this mistaken attack? Yep, the blood vessels. And that brings us to the key word here, vasculitis. This is the main thing happening in the disease. Honestly, the best way to picture it is to imagine your blood vessels are like the plumbing system for your entire body. Vasculitis is when that plumbing gets inflamed. It gets swollen, irritated, and damaged. And because you've got this plumbing running literally everywhere, from your skin to your eyes, all the way to your brain, well, now you can see why Behçet's can pop up in so many different spots. So now that we know what's happening, let's talk about what it looks like. This is where we get into the real-world signs of all that inflammation. And man, this list really shows you how it can affect the whole system. The one thing that's a constant, the one feature that's an absolute must for a diagnosis, is getting these painful mouth ulcers over and over again. But after that, it's kind of a mix and match. You might see genital ulcers or really serious eye inflammation called uveitis. That's where the blood vessels inside the eye get inflamed and can actually threaten someone's vision. Then there are different kinds of skin lesions. There's also this classic sign called a positive pathogen test. It's wild, where a simple needle prick to the skin causes this big inflamed bump. And yeah, in the more severe forms, it can cause everything from headaches and other neurologic problems to GI issues and even those dangerous blood clots. Now, this is a really important point. While anyone can get this disease, doctors are on high alert for two things that often predict a tougher road ahead: if the patient is male and if their eyes are involved. It's not that others can't have serious symptoms, of course, but these two things are like big red flags for doctors. They signal that they might need to be more aggressive with monitoring and treatment right from the get-go. Okay, so with all these different symptoms popping up all over the place, you're probably wondering, how on earth do doctors diagnose this? It's not like there's one simple blood test that just says yes or no. It's way more like being a detective, assembling all the clues to solve a really complex puzzle. To help with that detective work, experts came up with a set of international criteria. It's basically a checklist to bring some order to the chaos. Rule number one, the absolute deal breaker, is the patient has to have those recurrent oral ulcers. Check. Then you need at least two more things from this list: either recurring genital ulcers, those specific eye problems, the typical skin lesions, or that positive pathogen test we just talked about. But it's not just about checking boxes off a list. It's also a process of elimination. The doctor has to keep that detective hat on and rule out other things that can look a lot like Behçet's. Things like certain infections or even some types of cancer. They have to be sure before they land on that final diagnosis. All right, so once the diagnosis is confirmed, the game changes. The focus shifts to managing the condition. And you can probably guess, since the disease looks so different from person to person, the treatment plan can't be one size fits all. It has to be totally personalized, a tailored approach for every single patient. This chart here gives a really great snapshot of that tailored approach. Think of it like a ladder. On the first rung, if you're just dealing with ulcers on the skin or in the mouth, you might start with simple topical treatments or a medication like colchicine. But if things get more serious, like severe eye inflammation or blood vessel problems, you climb up the ladder. Doctors have to bring out the bigger guns, like systemic steroids or other drugs that calm down the whole immune system. And for the most severe, hard-to-treat cases, that's the top of the ladder. They use these really powerful biologic drugs, you might have heard of anti-TNF agents, that target very specific parts of the inflammation pathway. So, what's the long-term outlook? What does the future look like for someone living with Behçet's? Let's talk about the prognosis. The outlook is really a story of two different realities almost. On the one hand, there's some really hopeful news. For a lot of people, the disease tends to kind of burn itself out over time. It just becomes less active as they get older, which is great. But there's the other side of the coin. There's a really significant lifelong challenge, and that's the risk of permanent blindness from that severe eye inflammation. It's a huge concern, and it means you have to be vigilant, always. And that brings us to a super important final point about managing this condition. Because the disease can flare up, it can relapse at any time, you just can't let your guard down. Continuous monitoring is absolutely essential. Living with the chats really is a journey, not a destination, and having a great partnership with your medical team it's the key to heading off serious long-term damage. So let's end with this. Behçet's is this incredible and incredibly frustrating puzzle that's created by our very own immune systems. And while our treatments have gotten so much better, dramatically better, the ultimate question is still out there. What's it going to take? What fundamental discovery about our own biology will be the key that finally unlocks this puzzle for good? Something to think about. Thanks so much for joining me for this explainer.